What is positive behaviour therapy? Positive behaviour therapy helps people living with disability understand behaviour and build safer skills, with a focus on dignity, choice, and support. Behaviour is understood as communication, not something to be blamed. Skills are taught in a supportive way, rather than through forced or controlled methods. Emotional safety and trust are prioritised at every step. Families and carers are included to support consistency. Support is practical, person-centred, and based on real life. Who can positive behaviour therapy help? Positive behaviour therapy can support children and adults living with disability when behaviour affects daily life, safety, or relationships. The therapy supports people living with autism or ADHD, people with intellectual disability, people experiencing anxiety or psychosocial disability, behaviour impacting safety, learning, or participation. Support that includes the whole care network. Focus on understanding needs, not labels or judgment. How positive behaviour therapy works. Positive behaviour therapy uses a flexible, person-centred approach. Support is based on strengths, routines, and goals that matter in everyday life. Understanding needs and environments, setting goals for daily life and safety, teaching practical, useful skills, supporting families and carers, reviewing strategies over time, practicing skills in real settings. Positive Behaviour Therapy, PBS, and the NDIS. Positive Behaviour Therapy works within the NDIS Positive Behaviour Support PBS framework and focuses on understanding behaviour. It helps reduce restrictive practices by supporting everyday skill building and coaching, teaches safer replacement skills, supports emotional regulation, reduces reliance on restrictive practices, promotes dignity, safety, and participation. Benefits of positive behaviour therapy. Positive behaviour therapy can support calmer routines, safer communication, and stronger relationships. Here are some benefits of positive behaviour therapy. Better understanding of behaviour and needs, safer and more predictable daily life, increased confidence and independence, stronger relationships with family and carers, greater participation in home and community life, emotionally supportive and respectful environments. What positive behaviour therapy sessions look like. Positive behaviour. Therapy sessions are practical, flexible, and focused on emotional safety. Here is how PBS therapy sessions look like. Practicing skills together in supportive ways, coaching carers during real-life situations, using everyday activities as learning moments, sessions at home or in the community, telehealth options when suitable. Progress is guided at a safe, comfortable pace. Positive behaviour. Therapy supports safer behaviour by understanding needs and building skills that work in real life. Choosing a right positive behaviour therapist. Choosing the right provider helps behaviour support feel safe, respectful, and effective. Here are a few things to look for in the right positive behaviour therapist. A person-centred and respectful approach, involving families and carers in planning, clear and open communication. Strong understanding of NDIS principles, support that feels calm and non-judgmental. No pressure, rushing, or unrealistic promises. Get started with positive behaviour. Therapy. Getting started with positive behaviour. Therapy can feel easier when taken step by step. Here are a few steps you can follow. Talking with health or support professionals, reviewing NDIS funding and plan goals, contacting a behaviour support provider, gathering helpful background information, asking questions and exploring options, focusing on long-term wellbeing and safety. How Affective Care supports you. At Affective Care, we deliver emotionally centred positive behaviour therapy that supports dignity, autonomy and real-life wellbeing for people living with disability. Person-led and relationship-focused support. Grounded in positive behaviour. Support principles. Focus on understanding behaviour and teaching skills. Collaborative work with families and support teams, delivered with warmth, consistency and emotional safety. Practical strategies designed for everyday routines and real-life settings. Support that adapts at a pace that feels right. A supportive step when you're ready. If you're exploring positive behaviour therapy, Affective Care is here to support you without pressure. You're welcome to start with a calm conversation, to ask questions and explore options at your own pace. We take the time to listen, respect your choices, and support the next step that feels right for you.